Thank you everyone for tuning in. We have a repeat guest today. We have Alex Ribbentrop here, and he's going to be talking to us about substance use treatments. We were just chatting before we hopped on that this is way, way, way out of my skill set. So we're really happy to have him here again. So welcome back, Alex.
Thank you very much. I'm happy to be back and look forward to the conversation.
Yeah, so let's go over our housekeeping. So just some quick introductions. My name is Megan Mitchell. I am a child and adolescent therapist. I'm working towards my play therapy credential, and I'm the founder of Agents of Change Prep. We obviously have moved into the CE space, which we're really, really excited about. And then I'm also a doctoral student at SUNY Buffalo. And in that program, I focus a lot on technology and supervision and cultural humility. So that's just a little bit, in addition to all of the other interests I have, a little bit about me. And then let's talk a little bit about Alex. Alex specializes in complex trauma, family, and recovery. If you had tuned into our last discussion, he talked about how he got started in this work really in Florida and how that's kind of transformed. He's the founder of Live Free Psychotherapy, and he provides psychotherapy in Virginia, and he's also licensed in Florida. And then we talked about this last time, but he was in South Florida really at the height of the opioid epidemic. So that informed a lot about what he has done. And he talked about the system, what was a challenge, what were the barriers. And then I think from there, he's really gotten into a lot of the trauma work, family work, and recovery work, because it all informs us on our journey. So that's a little bit about Alex. And let me go over our learning objectives real quick for our CEs. What will we hit on today? Implementing trauma-informed care practices. I think we're going to talk, I mean, that's always an overarching, right? Especially when you're working with substance use. You want to make sure you're trauma-informed. I'm going to pick your brain a little bit about EMDR because you are trained in EMDR, and then we're going to talk about family involvement. We talked about that a little bit last time, but I remember from our conversation, family involvement is really crucial if you can engage from
Yep.
that perspective. And then, why is this important? We know that we were just talking before this, like addiction has really wide reaching impact. I think everyone has probably been affected by addiction in some point or another. So we're going to talk about the prevalence, like what does this look like? And I think it's evolving. We talked about that a little bit. We have these epidemics where there is a certain drug that
Yep.
becomes prevalent.
Yep.
Impact of trauma on addiction. We're going to talk about some risk factors, why someone may develop a substance use disorder, and then treatment approaches. As we evolve as a society, our treatments get a little bit more complex and a little bit more evidence informed. So, yeah. So, without further ado, I am going to kick it over to Alex. And Alex, tell us a little bit. I know this is what you do day in and day out, but tell us a little bit about your practice and the clientele that you cater to.
Sure. So as you noted, I moved into the private practice space in 2018, early 2019. Um, since COVID, have been working primarily virtually with folks that are in Maryland, Virginia, and Florida. And due to my background, I've focused primarily on working with people that are struggling with issues related to complex trauma, family systems, and that oftentimes overlaps with substance use, addiction type issues, process addiction, dependency issues, etc. So that's kind of my wheelhouse. I think at this point, um, doing family system work and working with families is probably my sort of most clear cut area of specialization, so to speak. Um, and again, I think to your point, I think a lot of that really was informed by experiences working in the treatment industry and seeing how impactful effective family work could be in terms of supporting recovery outcomes.
Awesome. So I wanted to pull up something to talk to you about and kind of see where your brain is with this. So there's this article that I pulled and it talks about some of the these are not all, but some of the risk factors. So I wanted to go through with you and go through each of these factors and tell me what your thoughts are about these different risk factors. So
Sure.
these are some of the main risk factors that this article studied. So genetics. So
Yep.
tell me a little bit about the statistic here is genetics account for possibly up to 50% of risk. That doesn't mean, if addiction is in your family that you automatically will be someone with substance use disorder, but tell me how you see genetics playing a role, and you work with families, so you might see the patterns there.
Exactly. So this opens the door to, actually, this slide really opens the door to like kind of what we do. And
Hmm.
essentially this is highlighting what we do in terms of a biopsychosocial assessment, right? Is that we're looking at a number of different considerations that combine to contribute to a person's susceptibility in
Yeah.
terms of developing a presenting sort of diagnosable issue, challenge, problem, etc. Um, the genetic component, it is a component, right? So, and this is where um, the disease model of substance dependence is helpful in terms of understanding some of this, right? It's not the be all end all, but it is analogous and helps us to develop an understanding of what we're seeing in terms of addictions presenting. Um, Similar to something like a cancer, right?
Hmm.
We know that there are genetic predispositions, there are susceptibilities that certain people have due to genetic factors in terms of cancer developing, right? And some of those genetic factors also play a role in terms of how treatable, how acute the intensity of that diagnosis is, right? So I would say it is, for simplicity's sake, analogous to that type of perspective when talking about genetics. Um, Going from genetics, we are we begin to consider, why is it that certain genes are passed
Hmm.
along rather than others? And generally speaking, especially when it comes to mental health issues and personality issues, a lot of that is rooted fundamentally in our survival instincts and capabilities. And so when we break down things like personality traits as we understand them are really the presentation of survival strategies of fight, flight, freeze, and fawn. And certain personality traits that are defensive in nature, they're protective in nature, right, are spurred, are prompted, and they grow when we're exposed to stress and we have a difficult time feeling relief from that stress. And that brings us into something like the adverse childhood experience study, right? Where we're collecting this set of issues, right, that are stressful. Those stressful issues contribute to our development of defensive strategies because we're having a tough time regulating ourselves. And that contributes to a susceptibility in seeking things outside of ourselves to regulate our internals. And that's an addiction, essentially. So that's a
Question,
ramble.
yeah.
But yeah.
Question for you about the ACEs. Of the clients you work with, do most of them have some sort of trauma or some sort of, I mean, we all experience ACEs, right? If
Right.
will they make you go through, but um does trauma, do you see with your clients that you work with, there is some sort of developmental trauma or trauma that was grow for them present growing up?
Um, the short answer is yes. And the start of the longer answer is life involves stress and challenge and difficulty um, at its best, right? And so then it becomes a kind of how are we defining the word trauma in this
Mm-hmm.
sense? But the short version is yeah, right? Is that we are all exposed to a variety of stressors to varying degrees. And then that gets thrown into the mix with this list of factors, right?
Yep.
So the genetic predisposition. So what am I showing up in the world with? What is my family system looking like? What have they shown up in the world with?
Mm-hmm.
And we mix all that together. And over time, again, a lot of what we're doing in life is figuring out ways to cope and to manage stress and to feel safety and regulated and okay. And it requires a lot of things going really, really well and a lot of factors working really, really well to be quote unquote healthy, right?
Mm-hmm.
The majority of us, arguably all of us, are dealing with some version of something, right? And then there's a percentage of people where their something shows up in this really acute presentation that involves substance dependence. Yeah,
One of those it depends answers, right?
yep,
Because we know some people respond to different ways. It's just like anything. Sometimes human beings are so resilient, it's absolutely incredible. And it's just a lot of different factors. Like you said, it's not one or the other. And some people don't respond as well due to a variety of factors.
exactly. That's exactly right. Yeah, all of it is a really big, it depends,
Depends.
yeah, situation. Absolutely. Yeah,
So
yeah,
this one was interesting to me as a risk factor. Remember, these are
yep,
just risk. This is not if you check the box for this, you are going to develop a substance use disorder. Developmental stage of drug exposure. So this study says if you are exposed to substances or alcohol earlier, it heightens the risk of addiction. Tell me more about that. And does that have anything to do? I'm guessing maybe brain chemistry and whatnot when people start using.
sure,
The brain's not fully developed even till mid-20s.
sure. So a couple thoughts come to mind immediately. One is sort of, think of it like something like learning an instrument or learning a language, right? Is that the earlier on we're exposed to learning some skill, right? The more ingrained it will become if we continue to practice that skill over time. Again, there's a susceptibility factor involved there as well. So if I start to play piano when I'm 10 years old and I experience that as enjoyable and I continue to engage in that behavior over time, right? I'm going to be much further along in my piano playing compared to somebody that starts at 18, right?
Mhm.
So, sort of simply put, that's what that is. And then combine that to your point with factors around sort of neurodevelopment and brain chemistry, um, something like what you're describing, right? Where we talk about the frontal lobe not being sort of fully developed and matured until mid 20s. I think generally we talk about the brain being more sort of malleable and plastic the younger that we are. Plasticity is still available
Mhm.
as we proceed through life. Um, is it to the same degree as it is when we're children or young adolescents? I don't think so. So that would be the primary consideration there. The other factor too is you're looking at, okay, well, what's going on in a person's life that they're picking up a drink or a drug at 10, 11, 9, 10, 11, 12, right? Generally speaking, that person, we're going to see a lot of these additional risk factors very much in the mix. It's usually not some random
Right.
occurrence. Yeah.
Right.
Yeah.
I was also thinking as you were talking about this, I wonder for the clients you work with that do develop substance use disorders, it's probably a lot of unlearning because it's been working for them for so long, right? It's like, oh, this coping, using this as a coping mechanism has worked for me. I
It,
feel better type of thing. So that is very difficult to get to the root of that and say this thing that has been working for you to cope for so long is actually not what we're trying to target.
yeah, I mean, it's when, so you hit the nail on the head in terms of the challenge of sobriety. So sometimes addiction is viewed as an attachment issue, and the form that the addiction or the dependence takes is the attachment figure because it's working in that way. So the substance or the behavior is providing solace. It provides relief to an experienced stress, right? It is very much doing something for us, and it's doing a really, really good job at it. Okay. It's providing a sense of emotional relief and sort of psychological safety
Mm-hmm.
that a person has not previously experienced, right? So the substance becomes the go-to attachment figure. It takes on, right, a parental space, so to speak. And so that then begins to backfire. And all evidence points to the fact that doing this thing is really not working. And
Right.
it's causing these really catastrophic consequences in a person's life and in the lives of many others. And so, rationally, a person can sometimes sort of see that, accept that, notice it, acknowledge it. Emotionally, subconsciously, and in the nervous system, right? That person's survival instinct is saying like, well, but this is my thing. This is my this is my safe place. This is my safe person. This is my thing. And it is very difficult to talk somebody out of
Yeah.
that type of attachment, right? So it's a very good point, and it really does in a lot of ways get to the root of the challenge when we're talking about this, and when we're talking about things like personality issues and defense mechanisms, is that they provide us very much with a sense of safety, even when we can clearly begin to see that they're backfiring and are
Mhm.
self-destructive. Yeah.
So that moves into personality traits. I'm thinking I work with, a lot of people with ADHD. Impulsivity is a very hard challenge. So how do some of these risk factors, like if I already have emotional regulation difficulties, or I am very impulsive, or, I have attachment issues, how does that play into it? Do you see that with like maybe people with ADHD or impulsivity issues struggle because we know with ADHD specifically, I'm thinking the dopamine levels are lower. So it's like you
Yep.
got to hit a bunch of different things here to get really to what's going on.
Yep. So we go like the way that I sort of make sense of this, and there's a thousand different ways
Yeah.
to try and conceptualize any of this, and there really isn't any one way that's like the be all end all right way. What we're doing is we're trying to develop ways of understanding presenting issues that then gives us an effective treatment route moving forward, right? Room for like a way of understanding a presenting issue in a person so that our interventions can be effective. Um, when we're talking about personality traits, the way that I understand those again is that they're extensions of basically instinctual survival
Hmm.
mechanisms. So we're wired instinctually with our fight, flight, freeze, fawn continuum of strategies in response to stress, right? And we're going to try out those strategies depending on the stress that we're experiencing. And at some point, we're going to land on something, again, in part because of environment, in part because of genetics. We're going to land on something that seems to be more effective than the other.
Mm-hmm.
So when we talk about something like impulsivity or reactivity, we're talking about a person that has experienced an efficacy of that kind of fight
Mm-hmm.
response, right? When we talk about somebody that's experiencing avoidance and they're showing up with a depressed, disconnected mood, right? We're seeing the emergence of somebody that has felt it effective to freeze,
Mm-hmm.
right? Or move away, detach, right? So those are the psychological equivalents of those survival responses. And then again, they become more and more acutely developed as we move through time. And a person is, if they're exposed to stress continually and experiencing relief from the use of the defense mechanism, that's just getting stronger and stronger and stronger, right? The person, though, is always is becoming more and more accustomed to living in survival mode, though,
Yep.
right? Either up here, hyper aroused, or hypo aroused, or fluctuating back and forth. And so when that person stumbles upon a substance that helps them to be here or here or here, their brain goes,
That's it.
there we go. I like that. Same thing with behaviors like cutting, behaviors like binging and purging, right? These are all acting on our nervous
Yep.
system regulatory system and providing us with senses of regulation and safety. As kind of dysfunctional as they are, right? They're coming in to the unbalanced nervous system and leveling things out. So the person's brain is going, hey, there we go. That's my thing.
Mm-hmm.
That we then have a snowball effect that becomes dependence. But very oftentimes, and you can probably argue all the time if you wanted to, personality disordered, quote unquote,
Right.
traits and characteristics are very much in the mix with dependency issues for sure.
And there's a ton of research out there now that's like showing the emergence of personality disorders. Like, does it go back to trauma at some point? And
It,
um,
yeah. And I mean, I would say like trauma at this point is such a it's a very, it's popular and that's good. It's so widely used that I don't know if there's like a really good understanding of like what do we actually mean by that word. And so it's a lot of, again, for me, about just the fact that no matter what, we are having to respond to stressors in life to varying degrees. And to some of that, we're going to respond imperfectly.
yeah,
And again, sometimes that's going to develop into a something for when we
that
throw
makes
all
sense.
these factors into
Yeah,
this.
another
Yeah,
risk factor.
exactly.
Everything's a risk factor.
Yeah,
Um,
everything's a risk factor.
it really is.
Yeah,
So
yeah,
that kind of leads us into the next one. So we know that in any type of treatment, we're dealing with co-occurring conditions. How do you tease out the different pieces when you're conceptualizing or clinically? Like, where do you target first? It's probably it depends, but assessment wise, how are you figuring out what to target?
yeah. It depends. It
It
depends.
depends.
It depends. Like I I think similar to the sort of assessment that we do in any case is that we're looking at we're looking at the presenting issues that are kind of directly in front of us and combining that with a history to start getting some traction on the clinical picture, so to speak. And then And then, yes, it is a teasing out of, well, is there a more clear-cut psychiatric consideration going on to explain some of what we're seeing in terms of a dependency issue, right? And, if there is something like a schizophrenia in the mix or a schizoaffective in the mix, all of these other factors are still present.
Right.
And we're also considering, well, maybe, right, maybe that's highlighting the importance of looking at a psychiatric avenue of treatment and medication management. And let's see where we are when we start a little bit of that process and then reassess, right? Like there are
Trial and error.
trial and error, right? There are also presentations that show up and you can sort of more clearly see that there's a lot of personality stuff going on. There's a family, you talk to the family and you see that the family has a lot of personality stuff going on. And again, we're taking this big amount of information and we're just trying to kind of pick some avenues to explore. And there's a bit of a trial and error art science
Hmm.
to that practice. And then
Yep.
prioritizing what what do we want to
What do
kind
we
of
want to target first and which avenue do we want to kind of approach this from?
yeah.
This is really where that like clinical expertise comes in, and you could be doing this forever. And there's some cases where you're like, am I hitting it the right way? Right. Or like, that's for me, it's those stuck points where I'm like, okay, I need to get some consultation here. Like what I'm doing now is not getting to where we want to be. So let me go back and like think of this a different way.
Yes, I mean, I think my experiences in this space has absolutely been the more that I do have done this and the longer that I've been in this space, you know, the it's so cheesy, but the less I know. Um and yeah, so that's absolutely correct. I was much more confident in my assessment ability 10 years ago compared to now in a certain sense. Um, but I
The more
think
you
that's just
know, the more you know, the more you don't know.
the more, yeah, really, this is really an exercise in that. Absolutely. Yep.
Yeah, I agree. And there's tons of for my doctorate, I'm looking at a lot of stuff. And right out of school, when people are asked, to rate their comfort level, it's always the highest, right? Because you just learned
No
all this
kidding.
stuff. Yeah. And then you actually see maybe 5 years in, it goes down. And then people don't hit that same confidence level to about 15 years in the field. So it's very interesting, right? And I probably was the same coming out of grad school. I know everything. Like I just studied all these things, and then you get out into the world and you're like, oh,
Yeah. Yeah.
oh, this isn't in a textbook, or
Yeah.
this
Yeah.
isn't as clear cut as I thought it was.
Yeah, it is true. And we are very much in the realm of the psyche and the
Yeah.
mind and the interconnection of the mind and the body, and it's a lot of question marks.
Yes.
So again, experience and exposure is definitely helpful, without a doubt. And but yeah, like we're really just there's this art science element to it, and you're taking the pertinent information that you can get, which is also a practice
Yep.
of like, what are the questions that I want to ask to get the information that's most needed in this case? And then again, kind of the trial and error, picking an avenue approach. Yep.
Yeah. We've talked about social determinants throughout, right? We know that these type of things are risk factors because what comes along with socioeconomic status, social support, adverse environments.
Yep.
One piece of the puzzle, of the complex jigsaw puzzle when kind of assessing for this. So that I feel like the social determinants really has been talked about throughout our discussion.
Yeah. I mean, really, your sort of baseline chance of exposure to stress
Right. Is higher.
is higher. Yep. And then you can have a cascade ripple effect from there for sure.
You
Yep.
think of Maslow's hierarchy of needs, if
Yeah.
those basic needs aren't met, we need to find a way to get them to be met, right? So you're gonna already be
100%.
more activated than
100,
someone else might be.
100%. Absolutely. Yep. And understandably so. Mhm.
Exactly.
Yep.
So I found this little quote. It's not really a quote, but this little piece of information from this article. And I wanted to hear how this plays into your work. The intensity of the intervention should be adjusted to the severity of the disorder and with attention to comorbid psychiatric and physical conditions. And this was, they were saying, when treating substance use disorders. So how do
Yep.
you determine what's the intensity? How do you determine the severity? Because those are words, but
Yep.
what does that mean?
Yeah. This is a great snippet. And really does, it says a lot and it says it well about doing treatment. So we can use a bit more of a clear-cut example. So you have somebody present to treatment, and they're presenting with symptoms and a history that indicates a schizoaffective diagnosis, right? And so that is a severe, significant diagnosis, and there's a co-occurring substance use issue as well. Now, right, this is the with attention to comorbid psychiatric and physical conditions. We have a comorbid psychiatric personality psychiatric condition, right? That's a person that you're not gonna hit that person with a heavy duty behavioral psychotherapeutic intervention, right? That's the person where we're gonna prioritize something like med management and
Yes.
stabilization before moving into or even considering sort of that space. Compared to a person that shows up with, let's say, a heavier antisocial personality or borderline type makeup, right? That's a person where, right, you are going to most likely need to intensify some type of therapeutic intervention, right, in order to challenge that defense structure. It's a very strong defense structure. It's not going to be blown over. So it is something that requires a push at times, right? And so that's what I kind of glean from this snapshot is, again, you're taking on the information that you have, combining it with your sort of clinical insight and experience and the modalities that you draw from, and then picking and choosing from there.
Quick question for you about the intensity. So you're working out right now, you work in outpatient, but
Yep.
is it a lot of like determining, okay, a higher level of care might be needed? How do you, as an outpatient provider, I don't do that with substance use, but for just mental health purposes with the work that I do, sometimes I'm like, I'm not able as an outpatient provider. You need a higher level of care, which might be IOP or PHP or something.
Yeah, I mean, it's a it's a good question. It's interesting, like, so sort of anecdotally or just in my experience, I don't have a ton of people reaching out to me that are in that high acuity substance use space, where I'm then learning more about what's going on with them and then going, oh my gosh, like this demands more significant
Right.
treatment. That those folks, for whatever reason, are generally not contacting me for outpatient therapy. Um, the families of those folks for sure are,
Okay.
and then that's very much, those are very much conversations that we're having where we're using this framework of like trying to understand what is going on with their loved one so that we can determine the most effective avenue in terms of pushing and where to push and where not to push and what direction do we want do we want to go? Boundaries and
Mm-hmm.
cutting people off and kind of giving those concrete ultimatums, those are great interventions for a percentage of people. Those are not across the board great interventions for everybody, right? It's like, do I want to be recommending the you're cut off uh you're cut off boundary to the person that's going through a psychotic episode?
Yeah.
No, right? It's like that's a case where we want to rally the troops and we want to get supports in place and treat this as a health crisis, as a health emergency, right? So that we can
Yeah.
get a person safe and stabilized. Um, a person that has been uh stealing and acting out in more, let's say, antisocial ways, yeah, like we are considering a more clear-cut boundary, and we're supporting the family in working through reasons why perhaps those boundaries haven't been in place before
Mm-hmm.
and have perhaps perpetuated the problem and have moved into something like enabling, right? But
Mm-hmm.
and that is important, is that appropriate support is not enabling. There, right?
Yeah.
There is a line there, and that line depends on the family system, the loved ones, and the sort of identified client. Um, so for whatever that's worth, that's a factor for sure.
I'm glad you brought that up because I think this must have been subconsciously because I've been watching very old episodes of Intervention. Like that we're talking like the 2006
Yeah,
episodes.
yeah,
And
yeah,
I have the mental health perspective, right? But I'm like so many you get the update at the end of the intervention episode and it's like they relapsed, right? And
sure.
it's because they're trying this very specific model with some of these people and it just made me think of it's obviously a show too, right? So they're
Sure,
not talking
sure.
about all the other work that would go into treatment, but and then it also got me to think a second piece is the family's always there, right? The family is so important for this because the
Yeah,
family's the one that comes together for this. So it was just got me, it was at the
yeah,
tip of my mind because I was been watching that.
yeah. No, absolutely, absolutely. Yeah, yeah, I don't want to get too off track, but it's just all of this is it's cliche, but it's cliche for a reason, right? It depends. And the sort of the good clinical work is really taking seriously the individuality of every person and every system, and then combining that with these sort of generalized understandings that we have on the clinical end that allow us to make a push and an informed decision moving forward in terms of something like an intervention.
Yeah.
But yeah, yep.
So last thing to quickly touch on,
Okay.
you're trained in EMDR, so tell us just a little bit about how this is used as a treatment modality for the clients that you see. And what is EMDR? I think most people have a general basis of what it is. It's becoming much more well known, but EMDR,
Yeah.
how often do you use it? Yeah, tell us about it.
Yes. So I did an EMDR training in 20 my first training in like 2014, something like that. And I would say personally, the biggest impact that has had for me is in terms of case conceptualization and understanding presenting issues. They have this framework called adaptive information processing. And for me, it was a really well done, balanced, integrative practice in taking these factors and then combining it into a workable framework. And it's looking at the ways basically that I won't do this total justice, but the ways that we integrate information, the ways that significant emotional information can get stuck, and the ways that our sort of our cognitive brain attempts to make reason of that stuck emotion. And it's heavy on identifying core beliefs
Yep.
as a way that we make sense of the world in adaptive ways and in maladaptive ways, right? So the I'm not good enough core belief is a way that a person has integrated a lot of really challenging emotional experience that has not been processed. And behaviorally and emotionally, that core belief continues to sort of play out over the course of a person's life in a variety of maladaptive coping strategies. So that kind of like conceptualization, again, it does a really good job of taking a lot of information and packaging it up. And then it's the use in EMDR, it's the use of bilateral
Yep.
stimulation, basically to loosen up the brain, so to speak. And the theory is that bilateral stimulation activates both hemispheres of the brain and contributes to that rational part of the brain and emotional part of the brain sort of being online at the same time and integrating experience more effectively. Um, I I use EMDR sort of sparingly. I'm much more kind of process oriented. Um, but I think, I think that it has really sort of exploded in popularity
Yeah.
for a number of different reasons. One of those reasons is I think that people that have been drawn to it and practitioners that utilize that strategy well, they see it as being really effective,
Hmm.
right? Like that's why certain modalities kind of take off. Not all of them, but certain modalities take off because clinicians are seeing them as effective, and that's been my experience and what I've heard others share.
Another tool in the toolkit
Another
is,
tool in the toolkit. Yeah, that's exactly right. That's exactly right. There's I don't think there's any be all end all
yeah.
modality or approach that I'm aware of. But
You figure it out, let me know,
I'll
because
continue to work on developing, yeah,
the magic wand that will just
yeah,
cure everything.
the unified field theory of psychotherapy. I'll figure that out. Give me like a week or two, and I'll probably have
Yeah.
something to
We'd be out of
roll
a job, but
on. Right. Yeah. So, yep.
so it's one modality and one similarly, like I feel like once you get into clinical practice, it's very prescriptive. It's depends on what you're seeing and what you bring into the session. I'm very much not a manualized treatment person because
Yeah.
that to me does not work great. So I take a little bit from all of the different things
Yeah.
I've learned, evidence bases that I've learned.
Yeah. I mean, I think that's a part of it. And it's not, it is an effort to be appropriately integrative. And yeah, it's like I think what you're saying, it's not just throwing a bunch of stuff into a bucket and saying I'm integrative. It's going, I have comfort and knowledge and experience in some approaches to treatment, and I draw on those depending on the client need and presentation, right?
Yep.
Right. It's just I'm aligning my expertise with what I'm seeing to develop effective informed interventions.
Yeah.
Absolutely. Yeah.
And just being trained in something doesn't mean anything really, right? I mean, yes, that's the baseline, but from there you got to take it and be ethical with it and use it in appropriate manners. I tell people that all the time, like, right, you could be trained in 500 different things, but that doesn't mean you're good at doing those things.
For sure. And I think the reality is all of this involves a marketplace and a business exists around everything that we're talking about, including trainings, right? So it's an effective marketing strategy to say you're going to be trained in this or certified in this, et cetera, et cetera. The degree to which that means anything really depends on the actual training and certification. There are some programs that are really, really involved and in depth
Mhm.
and do really tremendous, strong work, and they churn out really strong, talented clinicians. Um, but that's not the popular, flashy thing.
Right, right.
So definitely like buyer beware, um, for sure. Yeah.
Yeah.
Not to be a pessimist, but
No,
just
I
a
there's just
realist, perhaps.
that's what I tell people too. Just be very mindful and do your research.
Yeah. Yeah, for
Be
sure.
mindful. Be
For sure.
be an informed consumer is what I
It
tell.
no, yeah, that's exactly right. Yeah, exactly. Yeah. Yeah.
Well, we could talk forever and ever. I've listed some of the key resources here that we've talked about today and some of the you'll see they're very current 2023, 2024 resources for those that are interested.
Which is great. Yeah.
Yeah, and Alex, of course, as always, I wanted to thank you.
Yeah.
I was taking, notes very, very intensely as we were going, 'cause I think it just brings I don't work in this, but there's so much commonality just between attachment and I do a lot of nervous system and neurobiology stuff too. So it all comes together, even if this is not the realm that I'm in. So thank you for sharing your expertise.
Absolutely. No, thank you. It is. It's always a pleasure to be able to connect and talk about some of this. Hopefully I make sense
I hope
a
you
little bit,
do.
and hopefully it's helpful to some folks, and yeah, thank you. It's a great opportunity. I appreciate it.
Yeah, thank you, Alex. And for those of you that will be getting CE credits, make sure you take the post-test quiz and your evaluation. And once again, Alex, thank you for sharing your expertise with us today.
Thank you. Thanks so much.
I hope you enjoyed this continuing education course from Agents of Change. Want to earn your CE credits for this course? Visit agentsofchangetraining.com or the link in the description to purchase the course and take the post test. If you're looking for more CEs, check out our unlimited plan. You will get unlimited access to 150 plus ASWB and NBCC approved continuing education courses for one low annual fee. We're always adding new courses. Did I mention we also have 5 free CE credits available too? Check it out at agentsofchangetraining.com.